What are the two biggest low back pain mistakes that are keeping folks in chronic pain? Here we go. So, some of my experience with low back pain includes my education. I have a doctorate in physical therapy. I have a master's degree in exercise science, and I have a bachelor's degree in nutrition and exercise. I've been helping folks with their low back pain and serious spinal conditions for 17 years. And unfortunately, I have my own low back pain story that spans about 20 years. So that's why I'm so passionate about this. So, why do I think that we are mishandling low back pain? Well, the numbers don't lie. Okay. For the typical person who is diagnosed with chronic low back pain, and if they don't have surgery, the average cost in the first year after their diagnosis is over $7,000. That's with outpatient services. Okay. Manipulations, injections, massages, dry needling, pain medication, all sorts of outpatient services. Okay. In the second year, the average cost for someone diagnosed with chronic low back pain is almost $12,000 in services. Okay. And then over a 5-year period, the average cost for somebody after their diagnosis of chronic low back pain ranges from $31,000 to $43,000. Again, these are all sorts of treatments: massages, manipulations, injections, dry needling, pain medication, physical therapy, chiropractic. That's a tremendous amount of money. People who have surgery for low back pain are spending even more money. For 1 year after surgery, the average cost for someone is anywhere from $25,000 to $299,000. That's almost $300,000 in expenses in 1 year for someone that has surgery. Even worse, around 40% of people that have surgery for low back pain still have pain after surgery. So I would say, yes, we're doing something wrong. In my experience, people are being led to skip steps when it comes to treating their low back pain, and they're going straight for treatments such as injections, pain medications, or surgery. And we are skipping initial steps that can make a huge difference and can literally change the trajectory of someone's low back pain journey. And so, what I'm about to share with you are the two biggest mistakes. Let's go. Big mistake number one is ignoring pain triggers. And this relates to two types of pain: structural pain and nervous system pain. Structural pain is what you typically think of with an injury, any sort of a muscle strain or a ligament sprain or a tendonitis or nerve compression. It's your typical injury that you think about. Most of these injuries should heal on their own in 4 to 8 weeks. Ignoring pain triggers means we keep performing movements that further exacerbate the pain. Okay. It either recreates the pain or it prevents the injury from healing. So, aggressive stretching, aggressive strengthening, continuous movements throughout the day. We're doing these movements. Sometimes we just don't even realize it, but we're keeping our body in a state of inflammation, keeping the injury in a state of inflammation. Inflammation is actually a good process that the body uses to heal injuries. It brings blood flow to the injured area, and basically it brings good stuff in to heal the injury, and it gets rid of the bad stuff so that the inflammation can clear out. So normal inflammation is good. Where we run into trouble is chronic inflammation. Intuitively, we know that inflammation causes pain, and that's why we're so quick to reach for over the counter medications, anti inflammatories, because we know that if we take them, it reduces the inflammation. And if we reduce the inflammation, we know that that reduces pain. So we understand this. But for some reason, when it comes to low back pain, we tend to ignore that fact, and we push through movements and we push through pain. And then we don't realize that that's what's stopping us from recovery. A perfect example is an ankle sprain. We know with an ankle sprain to put a walking boot on it, or we wrap it, and we basically immobilize it for a short period of time. We give it a chance to heal. We give it a chance to let the inflammation clear out, and then we gradually rehab the injury. So we know what to do with an ankle sprain. We let it calm down first. Unfortunately, there's a problematic trend in healthcare right now where healthcare professionals are telling you your spine is meant to move. You should be able to move it however you want. And that's really not telling the full story. And it's problematic because that's ignoring the basic concept of inflammation and pain. If you have an injury and it's inflamed, there's inflammation. If you continuously perform movements that are putting stress on the tendon that's inflamed, putting stress on the ligaments that are inflamed, putting stress on the muscles that are inflamed, putting any sort of stress on the tissue that is irritated, you can't expect it to heal. You have to stop performing those movements for a period of time and let the tissue heal. So when someone tells you that you should be able to move your spine however you want, yes, but not when you're injured and not when you're lifting something really heavy. Case in point, a lumbar disc herniation. Most lumbar disc herniations happen when someone is lifting something and they're bending forward, and it puts the spine in a poor alignment, and it alters the forces that go through the spine and through the disc. And then there's a disc herniation. It's just basically a change in the direction of the forces in the spine. And so if you have a lumbar disc herniation, you have to stop performing that movement to give it a chance to calm down. Another example is a spondylolisthesis. This is a small fracture in a specific part of the vertebrae. It happens a lot in two groups of people. It happens with young gymnasts who repeatedly arch their back in severe ranges of motion. And it also happens in aging folks in the aging spine. And so when an injury like this occurs, you have to avoid those extreme motions where you arch your back, where you extend your back, because that is the mechanism of injury. That's the movement that originally caused the injury. And then it's also the movement that continues to make the injury worse. A third example is spinal stenosis, central stenosis of the lumbar spine. With this type of condition, when someone stands up straight or arches their back backwards, it narrows that central canal. It causes compression of the nerves that come down that central canal, and it results in the symptoms down the legs, the pain, the aching, the numbness. And so that's why you see people with spinal stenosis often leaning forward when they walk, because when they lean forward, it opens up that central canal. It takes pressure off of the nerves, and the pain in their legs is relieved. So another typical example of understanding what the injury is and understanding what the pain triggers are so you can avoid them. This concept of avoiding pain triggers, it also applies to pain that is generated by your nervous system. Like I mentioned earlier, most injuries heal in 4 to 8 weeks. Sometimes these injuries heal, but the pain persists. The pain continues on. In that case of chronic pain, the reason is not because of the original injury, it's because of changes in your nervous system. Even though the actual injury has healed, the signals that are being sent from where the injury was to your brain, those signals are continuing to be interpreted as pain in your brain. And then your brain sends signals back down and you're experiencing the pain. So absolutely, this pain is real. It's just from a different source. The actual injury has healed, but now your nervous system is on high alert. It's called sensitization. Your nervous system is on fire, and it keeps interpreting signals as pain when there's actually nothing wrong. In terms of ignoring pain triggers, it's the same concept as with structural pain. If certain movements are sending signals to your brain that your brain is interpreting as pain, then it makes sense to hold off on those movements for a limited period of time and then gradually, incrementally reintroduce movements once your nervous system has had a chance to calm down. So I'm not suggesting that you avoid all the movements for a long time, for a long period of time, just temporarily giving your nervous system a chance to calm down and then gradually, incrementally reintroducing these movements. And it's very effective. The reason why it's so important to learn your pain triggers and avoid them is because there is a cumulative effect of movements throughout the day. Think about how many times a day you stand up from your chair or you sit down. 20, 30, 40, 50. Every time you do that, if you're doing it in a way that exacerbates the pain or puts stress on the tissue that's trying to heal, or if you're doing it in a way that sets your nervous system on high alert, you can't expect yourself to heal. When it comes to your sleeping position at nighttime, if you're sleeping anywhere from 6 to 8 or 9 hours a night, if you're sleeping in a position that puts strain on the tissue that's injured, or you're sleeping in a position that keeps your nervous system in a state of hypersensitivity, same thing. You can't expect it to heal. One more example is riding in your car. If you take several trips a day in the car, that time accumulates. And if you're sitting in a position in your car that is putting stress on the tissue that's trying to heal, or you're sitting in a position that keeps your nervous system on high alert, again, you really can't expect yourself to heal. And so learning to recognize that is a huge step in your recovery process. So, big mistake number one, ignoring pain triggers. You can do all the rehab you want. You can do all the massage that you want, all the manipulation, all the dry needling, all the exercise. You can do all those things. But if you're ignoring your pain triggers and not giving your body a chance to heal or recover, there's a limit to how much progress you're going to make. You have to learn to recognize your pain triggers and avoid them. So that's big mistake number one. That's the big one that a lot of people miss. Big low back pain mistake number two is relying on passive treatments and basically not taking enough of an active role in your own recovery. This is actually the opposite of mistake number one. And a passive treatment is any sort of a treatment that involves you laying down or sitting down while someone performs a treatment on you. Okay, this might include a manipulation, it might include a massage, uh, acupuncture, dry needling, a ultrasound, electrical stimulation, anything that involves the healthcare professional doing the work while you sit or lay down. And reliance on that sort of treatment, unfortunately, is not the long term answer. Here's the reality of passive treatments and quick fixes. Receiving a passive treatment like a massage or a manipulation or acupuncture or dry needling, while it may feel good and it may actually give you some short term relief, it in no way changes the ability of your spine to bear load, to handle weight. Okay. And there's no long term benefit from it. And I can say that I'm extensively trained in spinal manipulation, and I love doing it. I love manipulating the spines of my patients, and I love the reaction that I get from patients. I love the quick relief that they get, but I'm openly telling you it's not the long term solution. It may be necessary and appropriate at the early stage of an injury, but after a few times, there's just no long term benefit. The only way someone really gets better is if they learn to change the way they move, if they improve their spine's ability to bear load, to handle weight. And that's what gives someone the freedom of long term relief without being dependent on someone like me or another healthcare professional to continually make appointments, to continually pay copays, and to continually just depend on somebody else for how you feel. So, to summarize, big mistake number one when it comes to low back pain is ignoring pain triggers. And big mistake number two is relying on passive treatments. Okay. What I really enjoy doing is teaching people how to change the way they move, teaching people how to address muscular imbalances, and teaching people to take ownership of their body. And it provides true long-term freedom. It's the coolest thing. It's the most rewarding thing. And so in the next video, I'm going to start to show you what I did to take control of my own low back pain issues that completely changed my life. So be on the lookout for that video, and thank you for watching today.